In terms of the implications of your work for the field of traumatic brain injury, are we talking about assessment advances or treatment advances?
Yeah.
Whereabouts is your work heading?
Well, both actually. So I guess I sort of span a few areas. I mean, I'm really interested in the theory, understanding what areas of the brain are actually involved in social cognition and how you and how that can fall down, and that leads to understanding how to assess it. And so we have a tool, the Awareness of Social Inference test, which is it's quite old now. It's about 15 years since it was published, but it picks up on these difficulties with reading emotions and understanding intentions and so on. And that's a really practical way that clinicians can find out what sort of problems people with brain injury actually have, rather than trying to guess it from talking to the families. And then following on that from that, once we know how to assess it and we know exactly where the problems are, the next thing is to treat it. So we've also got some research going in various treatment areas. Yeah.
So can you talk a bit more about that? So what kind of treatments are being developed?
Yeah. Well, we started off a few years ago with social skills training, and so social skills training sort of follows from a fairly standard behavioural model of these are the skills you need to interact with other people. And I mean, we did that a long time ago. In fact, you were involved in our first studies with that, and it became obvious then that you can't just expect people to have good skills if they can't read the other person. So that led to us developing Tacit and developing a whole lot of interest in the assessment of social cognition. And then a few years later, we actually ran a study looking at whether we could develop treatment to help people recognise emotions in other people. And Christina Bornhofen was a PhD student at the time, very talented clinician, and she went and developed these manuals, and we showed that we could actually improve emotion perception in in people with brain injuries. So that was successful, but now there are other aspects of social cognition that are still not at all treated, and in particular that ability to be able to think about what someone else might be thinking. So not just about what they're feeling, but what things might they be thinking from their perspective. And so
kind of complicated, isn't it?
It is quite complicated, and I guess it is complicated. And the thing about those sorts of skills is they also require good working memory and good language. But even if you have good working memory and good language, you can still have difficulties being able to put yourself in someone else's shoes and see things from their perspective. So that's what we're thinking about.
So that's a future direction.
Yes.
Your research is really focusing on those.
Yes, so we're sort of trying to think right now about ways that we can look at helping people have a better, what is called theory of mind. So being able to think about what another person might be thinking. Yeah.
So what are the clinical implications of this work?
Yeah. Well, I think there's huge implications. When I first started working as a clinician, we had nothing to help us work out if someone with a brain injury had problems reading other people. And now we have Tacit, and there's actually quite a few tools around now.
And Tacit's quite widely used internationally.
It's used throughout the world. I guess it uses audio-visual vignettes. It's a bit like watching a soap opera or something. You've just got these two actors talking to each other, and you've got to be able to work out what they're thinking and feeling. So that's used across the world. It's also used in a lot of different conditions, not just brain injury. It's used in frontotemporal dementia and schizophrenia and Asperger's disorder, autism spectrum disorders. So quite a few different conditions are using it, because it turns out these social cognition problems aren't just specific to traumatic brain injury. They go way beyond that. But anyway, it is an opportunity that clinicians now have, these really kind of ecologically valid tools to assess what sort of difficulties a person might have in social cognition.
And in terms of the treatment implications, so Christina's work is available for other people?
Yes, we've published that manual that's called Reading a Smile, and that's available from a little company we have called Asby Resources. So that can be bought by clinicians, and it's got and anyone for that matter, but it's got all sorts of extra resources like photos and games and things. We've also got the social skills manual I was talking about. That's also available. Yeah.
And those resources are really, they're not just for speech pathologists or psychologists. They're multidisciplinary.
They are multidisciplinary. We haven't said that you have to be of a particular profession to use those tools. They're really available for anyone, because these issues are actually multidisciplinary, and it's not necessarily going to be a psychologist who's going to be addressing that. It might be the speech pathologist, might be the most appropriate person, or even a social worker or an occupational therapist. It just depends on the particular setting and what sort of roles they're playing. Yeah.
And how comfortable they feel as well.
Yes,
presumably.
that's right.
Yeah.
That's right. Yeah.
So in terms of a clinician using this in their clinical practice, how would you envisage that a clinician would approach the problem of social cognition? What would they've got someone coming in, the family are saying, they're not the same person they used to be, they're just not responding to me like they used to. What does a clinician do?
Well, I think any clinician needs to start with assessment, so you know what you're dealing with, and I think things like tacit are useful. So we've now got these resources where you can assess what's wrong, and then if there's the time and resources available, then a treatment, because we're showing that at least emotion perception can be treated if the person has difficulty with that. Yeah, and we've got the manuals, so hopefully there's more resources for clinicians to actually address these difficulties.